Well, I don't think it's exactly a news flash, but man, we don't always take care of ourselves, right? Sometimes it requires, as you know, it's a little bit of arm twisting to get in for that physical.
I've done that a number of times at our house. Nebraska Medicine is taking a convenient approach to education this June, National Men's Health Month. They've organized a forum with some of the common issues men need or just want to know about.
Yeah, here today, Dr. Chad LaGrange and nurse practitioner Anna McCrane.
It's nice to meet you.
Hi,
Anna.
Well, listen, confession, I think it's been 2 years, 3 years, maybe since
Oh,
I've gotten for my physical. I'm usually pretty good about it, though. But this is a great opportunity for men. It gets the Men's Health Forum. What's the idea?
Well, it's an event sponsored by Nebraska Medicine, as you mentioned, to address men's health and a multidisciplinary approach, not just topic specific. It's on June 10th from 6 to 8 out at Village Point. Our goal is to educate men and their loved ones on a magnitude of topics.
Yeah, all kinds, as I was looking at the list. Give us a few examples of what you'll cover.
We're going to talk about sensitive topics, but I think important topics for men. So erectile dysfunction and low testosterone, prosthesis. But we're also going to talk about cardiovascular disease, hypertension, high cholesterol, and obstructive sleep apnea.
Yeah, all important issues. Doctor, I see these ads all the time now for low T, low testosterone. What should we know about that?
Yeah, it's become a very hot topic, and we see more and more popping up every day. It seems I literally heard a new one this morning. It's become kind of the vogue thing. Unfortunately, I think a lot of guys are getting wrong information. A lot of guys are getting sucked into going somewhere to try to get a quick fix, and 27% of men don't even have a doctor. And so if they can go somewhere and just kind of, it's not really a doctor's visit and I can still get something taken care of, well, I guess we're a little worried about that. As healthcare providers, we want to make sure that men are getting good information, getting good treatment, getting good follow-up care, and not just focusing on the one little thing that they're going in for, but having their entire health taken care of.
What are the signs and symptoms of low testosterone? What should we be on the lookout for?
Yeah, so unfortunately there's some very vague symptoms that any American can have, including women even. And then there's more specific symptoms like low sex drive, problems with erectile dysfunction, maybe depressed mood, but even those are a little bit vague. And so that's why it's important to not just show up and get a testosterone shot and walk out the door, because it could be something more serious going on.
Right.
And is that one of the risks if you're not taking a comprehensive approach to it?
Definitely. I mean, there's a lot of treatments that can have side effects and can affect other problems. I mean, more importantly and shockingly though, 52% of men between the ages of 40 and 70 have erectile dysfunction. And of those, a vast majority have serious underlying health conditions. And if you help focus on those, maybe the erectile dysfunction actually improves, and libido improves, and mood improves, and sleep improves, and everything else improves,
Unfortunately, these clinics are based on marketing and not healthcare, and that's what we want to provide as a general multidisciplinary approach, that these are actually symptoms of bigger conditions.
There was
we want to
something
include that.
You said sleep apnea, which I feel like affects a ton of people, but they might feel like, well, there's nothing to do about it. I'll just suffer. What's the big deal?
Yeah.
What is the big deal with it?
There are big effects on that. There are genitourinary effects, but also just general health. If that goes on long term, it can have effects on your heart, and I don't think the general public realizes that.
You were talking about the conversation with low T and kind of more of a marketing effort out there by some companies. Is it? I guess, is that what partly inspired the Health Forum? What's the inspiration behind it?
Yes, the inspiration, well, as Dr. LaGrange mentioned, 27% of men have not seen a primary care physician in the last 12 months. So that leaves a gap that leaves these men susceptible to these marketing campaigns. That's an easy thing, quick fix. I mean, I'm sure you've heard the commercials. It's an easy, gimmicky thing to just be pulled into that, but you're not getting the full medical care that you really need by doing that.
And some of these topics, guys might not feel comfortable starting the conversation, but if you're just sitting there, hey, I came to learn about heart health, but I'd really like to learn about a few other things while I'm here, then it makes it a little bit easier to digest the information, doesn't it?
Yes, and we have some great physicians, Dr. LaGrange being one of them, speaking on all these topics, including what I had mentioned before, but cardiovascular disease and obstructive sleep apnea as well.
Yeah, we're taking a look at the agenda right there. It starts at 6 o'clock, and it's Wednesday, June 10th, and it starts with the obstructive sleep apnea, as you said, goes down the list, and you hit low T and erectile dysfunction, Village Point. It's at the Cancer Center, right?
Yes.
Correct.
Are reservations required?
Preferred. It helps
Yeah.
to plan. there's going to be some other vendors and so on and so forth there, and so it's nice to have kind of a head count.
I like that it's an hour and a half. That's
Yeah,
manageable.
pretty short. And each topic is only going to be, 10, 15, maybe 20 minutes. When then time for questions is what's important too.
Can we touch on coronary artery disease real quick?
Yeah.
What should men know about that? And I know we don't have a lot of time, but
Yeah, no, there's really shocking evidence that, if you're having problems with erections, for example, there's an incredibly high chance that you also have a serious heart condition because they go hand in hand. They're
They're
both
related
blood
to blood
flow.
flow, yeah.
They're both blood flow problems. And so it really is important to talk to a doctor about these issues.
That's why we said off the top, topics men need to know about or want to know about, but to be able to do it all under one roof in an hour and a half, I think it's a great idea. So let's remind you again about where you're going, when you're going. Please RSVP just so they can organize a bit there. You'll call 800-922 and then 4 zeros. Easy to remember, at Village Point, starts at 6.
Free food and drink.
Do free food and drink.
what else is going to get
men.
guys
Yeah.
there? Right.
I'm glad you threw that in. Thank you, and we hope the 10th is a great night for you.
Thanks,
Nice
Laura.
to meet
Thanks, Laura.
you.
Appreciate it.
We